Tonight at 10, Marissa Mays will have the much-publicized LASIK eye surgery.
That's right, and this noon we are joined by the doctor who will perform that surgery. Now, you've seen his commercials, and now he's here to talk with us. Dr. Coleman, thank you so much for joining us today.
Thanks for having me, Augusta.
How bad does someone's vision have to be eligible for this type of surgery?
That's actually a very personal scenario for any given person. I've learned not to make subjective comments on how someone sees. Some people that I see have very thick glasses and I think they really should do it, but they're a little bit timid or scared, and others that have smaller ones, it's a little different.
Explain to us in layman's terms what this procedure entails.
What LASIK entails is changing the shape of a person's cornea with a laser so that they can see clearly, so that things aren't so fuzzy typically in the distance, but we can also help people that are farsighted and have little problems up close.
Amazing.
How long does it take?
I tell people it's a little bit like the Kentucky Derby. So the race itself is 3 minutes and the surgery time is relatively brief, but there's a lot of prep time and there's a lot that goes into it following. But in general, Marissa tonight will probably be in the laser room 20 minutes.
Wow.
Let me ask you this, and it might be a myth. I talked to somebody, you hear things at various places, and somebody once said, I would never have laser eye surgery done because you only get one pair of eyes, and if they do it wrong, I could never reverse it. What would you say to a person that said it to you?
Craig, I'd say I would agree with that person to a certain extent. Procedures like this aren't for everybody. For some people, contact lenses are ideal. For others, glasses are ideal. And for others, laser correction. It depends on lifestyle, what their priorities are, and really what they're trying to get out of it.
This is so popular and so interesting. Thank you so much, Dr. Coleman.
He is Albuquerque's most recognized eye surgeon.
LASIK surgery has caught on quickly here. Now tonight, live at 10, Dr. Stephen Coleman will perform the surgery on our Marissa Mays. But right now, it is time to take your calls as promised. And I think we've got Rick from T. Harris with a question for you, Dr. Coleman. Go ahead, Rick.
Hi, doctor. I have had cataract surgery and I have lens implants. Would that make me a candidate for LASIK?
That's a great question, Rick. I have done LASIK on patients who have had prior procedures on their eyes, including corneal transplants as well as cataract surgery. It's a very difficult decision, and it's something that requires a very thorough examination to make sure that you would be eligible. But in general, I would say yes, provided there's no complicating circumstances with your particular eyes.
Okay, Christy from Albuquerque, you're next up with a good doctor. Go ahead, Christy.
Hi there. I'm nearsighted in one eye, and I have a pretty bad stigmatism in my other eye. Are astigmatisms correctable?
Yes. Currently, with the laser system that I use, I can treat people who are nearsighted, people who are farsighted, people that have astigmatism, and all combinations of the above. In fact, Christy, most people have a little bit of astigmatism that requires simultaneous treatment during the LASIK procedure. So the answer to your question is yes.
All right, Joyce from Albuquerque. Go ahead with your question for Dr. Coleman. Joyce?
Dr. Coleman, I have amblyopia or lazy eye in one of my eyes, and I'm wondering if LASIK can be used to correct my weak eye.
No, actually, LASIK would not help an eye that's lazy. That has to do with the muscles in the eye and an alignment disorder. We change the shape of the cornea with the laser, and we don't affect the muscles. So an eye that is lazy or turns in or out would remain in that scenario following a LASIK procedure.
Okay, moving right along. Anna Marie, you're next up with Dr. Coleman. Go ahead, Anna Marie.
Yes, I have a daughter that has retinitis pigmentosa, and I'd like to know if she would be a candidate for this.
No, she wouldn't. Retinitis pigmentosa is actually a disorder of the retina in the back of the eye that typically limits the vision of any particular person over the course of a lifetime. Again, with lasers and LASIK, I change the shape of the cornea, which is the front part or the covering of the eye. So they're two anatomical different areas, and I wouldn't recommend LASIK for a person with that condition.
All right, time for one more call. Kathy from Espanola. Go ahead, Kathy.
Good afternoon. I have a question regarding the actual surgery. I was able to view the surgery. Several of my family members had the surgery, and it proved favorable for them. But what advice could you give to someone who's just absolutely terrified of someone working on your eyes like that?
Yeah. Well, in general, most of our patients, quite frankly, share that same concern, and they're very nervous and anxious. We go to great extents to make people comfortable. I personally give people a little sedative prior to the procedure that will relax them, and then because you're awake during it, there's a lot of what we refer to as verbal anesthesia. In other words, people, I'm talking to you and sort of explaining to you as we go along. But that's something that's sort of surgeon dependent in a sense. We all do it a little bit differently, and if you sort of tip us off beforehand, I'm sure we can make you comfortable.
Dr. Stephen Coleman, who you'll see on our Action 7 News Live at 10 tonight. A fascinating topic, and we thank you so much for taking your time to come from a busy day, no doubt for you, and come in and talk to us and our viewers. Thanks.
Thanks,
Craig.
Dr. Coleman. Now remember, you can see just how fast this LASIK eye surgery is tonight right here on KOAT 7, as Craig mentioned, at 10. Be sure to join us for Action 7 News for a live demonstration on our own Marissa Mays. That's LASIK surgery live at 10 tonight.